It doesn't take a rocket scientist to see that the healthcare system in America is broken, especially as it relates to chronic disease, which is disproportionately impacting Black communities at an alarming rate. The stats don't lie. More than half of Black men and women have high blood pressure. Nearly 80% do not have their blood pressure under control. Black men are least likely to reach 65 in the U.S. Black men are the only group for which increased socioeconomic status has found to be positively related to stress, affluence, healthy lifestyles, and access to high-quality health care are not equally protective across race and gender groups. As many of you know, I recently had a stroke, and I'm on the comeback, and I've made it my mission to help as many others as I can on my journey back. That's why I came out of retirement to support the Release the Pressure campaign, which brings together organizations dedicated to improving healthcare in our Black community. Before we even get started, we want everyone watching to go to www.releasethepressure.org to take the Heart Health Pledge. So it's my pleasure to be leading a conversation today that I hope will bring about much needed change. Joining me today to talk about racism in healthcare are Dr. Oliver Tate Brooks, the immediate past president of the National Medical Association, Charles Harris, an attorney and partner at the law firm of Mayer Brown LLP in Chicago. We also have Christopher Gomes, who is the Chief Equity Officer at Thrive Chicago, who also leads President Obama's My Brother's Keeper initiative in collaboration with the Obama Foundation. Gentlemen, thank you. Thank you for taking the time to discuss this important issue. Let's get it started. We'll start with you, Dr. Brooks. Dr. Brooks, as a former head of the National Medical Association and a practicing primary care physician, from your perspective, sir, what's wrong with the American healthcare system? And is there racism in our healthcare system?
One of the problems with our healthcare system is that it is fragmented. We do not have universal care where everyone is covered under a system that works together. Isabel Wilkerson said in her book, Caste, that the reason she believes it's like that is that the philosophy of America is this individual ruggedness versus other westernized countries that all have universal care where they look at the collective good. We do not look at it as the collective good in this country. Now, to the question of is there racism? The healthcare professionals generally reflect the country, both in the numbers of the majority community in African Americans and in their perceptions and their thoughts regarding racism. I can just give you a few examples. During the early days of COVID, it was much more difficult for Blacks to get tested. And this was shown by the higher rate of Blacks testing positive. You had to be really sick to get tested. There were some studies done with sickle cell patients. 50% of them, 13 to 21 years of age, reported sensing and feeling discrete, explicit racism and bias. And these are obviously Black children and young adults. And then as relates to pain, there are studies that show that Blacks tend to get less aggressive pain treatment, opioids, and necessary treatment. So yes, there is clearly racism in our healthcare system.
So Christopher, what are some prevention messages you'd share with your younger self if you had the chance?
Yeah, that's a powerful question, Tom, and I appreciate that question. With regards to men's health and things like that, my mother is really incredible with like pushing our health and having the conversations early so we would avoid some of the things that we witnessed in my dad's life with alcohol abuse and things like that. So I'm fairly healthy and proud of that and keep monitoring my own health. But I think what I would have loved to know earlier is the importance of mental health and emotional health. That just wasn't talked about in our families with regards to like going to therapy and getting some of those things, just talking to a therapist and prioritizing our emotional health there, and how we actually take care of ourselves emotionally. I had to learn that later in life. And when things just got a little bit stressful and I couldn't quite figure things out, and could not implore the things that normally have worked for me, I needed to speak to someone and speak to a professional. It doesn't mean that I was on the brink of suicide or a nervous breakdown. It's just you needed to process some things, and I wish I would have known that earlier. And one of the ways that we kind of incorporated that mental and emotional health within the work that we were doing when I was a principal. Typically, schools in Chicago do not even implore a full-time social worker, but I made the decision as a principal that keeping in mind the community that we were serving, and prioritizing the emotional health of my students, is I not only hired one full-time social worker, I hired two full-time social workers, because I wanted my students to know when you're struggling with something or you feeling overwhelmed, there's a place for you to go to process your thoughts and your emotions, and there are people who are trained to help us with coping mechanisms. And I wanted to normalize young people talking about their struggles, their personal struggles, and their emotional health. So I wish I would have known that earlier, but I took my lessons and tried to share that with the young people that we serve.
So, another, and Chris, I think you make some important points about mental health and going and seeing specialists and physicians and people who are, like I say, specialists in those areas. But another thing that I think we need to focus on as Black men is talking to each other. I mean, because a lot of us are about our difficulties and some of the things that we're facing at work and mental health and physical health and those type of things. Because as we've talked about already through this discussion, I mean, a lot of us, like Chris's father, we're the only ones in our professions. I mean, for instance, I mean, equity partners at what we call AmLaw 100 law firms. So that's your most profitable law firms in the world, are less than 1%. So there's very few of us, and a lot of us are in environments where we're the only ones. And that is a very, very, very difficult thing for your stress level and for your mental health. And a lot of times when I go talk to others who are in the same situation at different law firms or in different cities, I mean, that is helpful. I mean, that helps relieve some of the stress and relieve some of the pressure. So we need to talk to each other more. And I just think for whatever reason, that's something that Black men don't really do.
So you can't be poor and Black and maintain your health and get good health care in this country.
Well, that's a very good question. The answer generally is yes, you can. But when you factor out everything, education, wealth, insurance, you still have Blacks having poorer outcomes. So we just have to work harder to get to where we need to be as a people.
Civil rights and separate but equal was eliminated. That if you're gonna become a Black doctor, there was Meharry, Howard, Morehouse, that that was the pipeline for Black doctors. Where is it now?
Right now, it is at those three schools, and then at Charles Drew University in South Los Angeles, where I happen to work. The pipeline is in those areas where Chris is working to get these young men and young ladies too, Black, oriented towards STEM. So the other thing that we need to do as professionals in my field, as African-American academics and administrators and educators, that get on these admission committees. So if you apply to UCLA or Emory, there are Blacks that are reviewing your application. So we want to have African Americans coming through medical school, all of the medical schools, every one of them, and in higher numbers. And you brought up a good point, Tom. We're not there yet. Number of African Americans in medical school It is approximately 4%, and it was 4% 50 years ago. So
Wow.
we are not improving there. We're having better access. I can get on medical staff other places. I can interface with Medicaid and Medicare and can have a bigger staff. But we need more Black doctors. And the things that we're discussing here will, if seen, if realized, will increase the pipeline and get us more Black doctors out there.
So, Dr. Brooks, that's an excellent point around the pipeline to increase more young men and young Black people going into the medical field. I want to emphasize the point that one way to do that is increasing the number of Black male teachers that are actually teaching the STEM courses while young people are in school, and they are starting to make those decisions around what they want to major in, what they want to do, and tailored courses built to address that addresses these health disparities and empower these young people to go to school and be the change that we seek. And I keep saying that over and over, and I get that from our illustrious President Obama, but I think that's just so key and so critical to really putting in front of young people windows and mirrors where they can see themselves and someone who is really pushing and inspiring them to be the change we seek. And then the one thing that I will say, I'm a high school principal, and I had an opportunity to found my own school. And anytime it came down to the point of trying to find a teacher for math, science, it was the most difficult thing to find a Black person, especially a Black male in that field. And so no wonder young people do not want to major in, if they are going to college, they're not totally interested in a career in medicine or science because, the teachers that they don't see teachers that look like them in the space. And so I just can't emphasize that point enough.
So thank you for being here, Tom. So one of the things that Chris and also Dr. Brooks said that wanted me to tell my story, wanted me to get in here and tell my story a little bit, is about the windows and the importance of seeing somebody that you think that, you can be that person one day. So I have an MS and a BS in biology, even though I practice law. And the reason that I got interested in science is because of an incident, I guess I'll call it. I needed stitches when I was about 10 years old. And I went over to Duke Hospital, and the person who sewed up my finger was a Black male. And he was an orthopedic surgeon. And from that experience alone, I grew up wanting to be an orthopedic surgeon. I ultimately didn't do that for a lot of different reasons, which we don't have time to discuss. But I just wanted to tell that story just as an example of the importance of seeing people in the windows and what we need in order to increase the number of Black people in science.
The COVID-19 pandemic has helped to shed some light on health inequities that exist in the country, particularly around heart disease. But there are also social factors that impact our health and well-being. From each of your perspectives, how do you think the Black Lives Matter movement, the death of George Floyd and many others, unarmed Black men and women who have been killed unjustly in our country, particularly at the hands of police officers who are hired to serve and protect our communities, how does that impact the health and well-being of the Black community?
There was a study that showed that when there was an African American killed by the police, there was an increase in mental health issues with Blacks throughout the state in which it occurred. State. So someone was shot in Illinois, in Chicago, people in Springfield, Black people in Springfield reacted to it. So these murders have a negative effect on our community. From ages 25 to 34, the number one cause of death of Black males is being killed by police. So we can't downplay it. What makes Black lives important is that Black lives have not always been important. I won't say never been important, but you think of the life of a Black man under slavery. I mean, we lived till maybe 30 or 40. They killed us, overworked us. So the concept that we have to say Black Lives Matter is real. Black lives have been devalued, dehumanized, in America. So the fact that we're out there saying it and then it is being adopted by many in the majority community, I have to say, I mean, this what happened in 2020 was unprecedented, and we know there's more that need be done. But the response to Black
Excuse me.
Lives Matter by the broader community was major, and we cannot lose that momentum.
Yeah, I would like to comment on that too, Tom. I do. While it was tragic and it's horrible to see these things play out over the screen, with all the Black Lives Matter protests and what has sparked all of that and the death of George Floyd and so many others, I do appreciate the conversations that are actually happening now, and we all know that we're nowhere near where we should be. But I appreciate in my space the conversations that are actually happening. We have to face this thing head on. And COVID-19 and the racial pandemic that has happened is just a new gear in an old machine.
All right, speaking of COVID-19, there's a vaccine now, but a lot of Black people, especially ones I know, are hesitant about taking the vaccine because, well, we got a history. Tuskegee study. How do we change that? Because if the vaccine isn't given to our people, we'll never get rid of this COVID-19 pandemic.
Tom, I haven't heard anyone say it just the way you did. If we don't get it, we're not going to get rid of COVID-19. Thank you for making it plain. Guess it's obviously one of your skills, but it's so important. So I work in the vaccine field in terms of activities. There is a lot of vaccine hesitancy. You mentioned the Tuskegee experiment. There's also the sterilization of Black women around the turn of the 20th century.
Mm-hmm.
During slavery, we were sold to have experiments by doctors. They robbed the graves of slaves to take the bodies north to use in the medical schools. So it's not fanciful that there is a concern. It's not a conspiracy theory like a lot of things we're hearing. It is real. So first of all, we have to do is address it straight on. Yes, there are issues with African Americans in the past. So what we did at the National Medical Association, we met with Pfizer, Moderna, AstraZeneca, J&J, and asked their top scientists, just them and us, tell me everything that we had questions about. And after we reviewed them, we feel at this point that Pfizer and Moderna are acceptable vaccines for the Black community, for everyone, but we're speaking for the Black community. So we have to have trusted messengers get out there and state categorically what you said. If you don't get the vaccine, you're going to end up with COVID. It's not going to be rid from our community. We're dying at 2 to 3 times the rates. So do it. I would lastly say this. Tuskegee was 50 years ago, and we've learned from Tuskegee. We were 10% of the clinical trials of both vaccines that are on the vaccines that are on the market right now. And they've been monitored in terms of the clinical trials by African Americans. People know there have been African Americans involved in the actual science of this. So we have to make it clear, and it gets back to what we were talking about, messaging. We need to have the message done properly. I mean, maybe Chris's people can help us with that, because that's where he has the pulse of the community.
I'd like to add to that, and thank you, Dr. Brooks, for the pitch over here. There are specific campaigns that are curated for communities of color, and we see it reflected in political campaigns. We see it in marketing for different things, and I believe that's one of the things that we should be doing. Our medical community and the vaccine producers should be imploring culturally relevant marketing strategies or marketing experts to help lead and be in our communities, and it trickles down. We've seen it happen with the AIDS epidemic, and how oftentimes the Black faith community was leveraged in order to convey the message around HIV and AIDS, and we've seen that. I can't really say that I've seen that in totality with getting the message out around the vaccine to Black communities. And one of the things I've taken upon a personal responsibility to do is having conversations with members of my family. I have members of my family who said, cousins and things, who said they will not take the vaccine. And I just remind them that when you were born, you were given a vaccine and you had no knowledge of it. And so there are vaccines, and we know better, and we're doing better. And I just share with them, hey, I don't want you to die from this thing. I don't want you to catch COVID. And I don't have much research to back up the vaccine, but I do know that it is a disparity in the messaging in our communities, and we have to all take some level of responsibility with helping our people get there.
When it comes to Black men and healthcare, the subject is, we really don't want to talk about that. Well, what do you think we can do to improve the health literacy in our community?
Yeah, I really do appreciate that question, Tom. And the thing that I believe that we can do is that curriculum should be built targeted for Black people. Curriculum needs to be built that it's targeted for boys and young men of color. And we are doing that work we are building an initiative here for Chicago to train and build an army of male educators of color. And it starts with a high school course that Black boys and young men will take while they're in high school, but it's targeted. It's built specifically for young men. And I believe that we can do that in the healthcare field. In the subject of around STEM, we need to be building curriculums. And we cannot depend on all these other curriculum builders and textbook organizations that are rooted in white dominant culture. Black educators can build their own curriculums that can be implemented within our schools. And I believe that that's what we can do to really amplify the disparities that exist in our community. Young people need to know about these things before they become adults. We need to start sharing with them the data that we're talking about right now in this very meeting. And when we're having conversations like this, how can we lift up the voice of young people, and how can we incorporate them into conversations like this? Because they will share it with their peers, they'll share it with their families, and then we start seeing multi-generational change over and over.
Health literacy is often interpreted as how intelligent you are, how literate you are. But the true definition of health literacy is how you interpret health information. So with the focus on getting the information in a method or a manner or a form that the African-American community understands and accepts, and also is relevant to the African-American community, is what true health literacy is all about.
Let me go to you, Charles. Dr. Brooks says stress is killing us more than anything, and especially when it comes to healthcare. You lost your father to heart disease, right?
Yes, I did.
So can you talk about the toll that took on your family?
Absolutely. So just a little bit about my family. I grew up in Durham, North Carolina. I have two sisters. I have one older sister and one younger sister, and my mom. So that was the family. My father died unexpectedly from a heart attack. At that time, I was in college. I think I was a sophomore in college. My older sister was a junior in college, and then my younger sister was still in middle school. So like a lot of Black families, my dad was a very strong figure in the family. So he controlled the money. He was a disciplinarian. He was a centerpiece of our family, as you see in a lot of Black families. And so my dad loved to eat. So, he had issues. He had high blood pressure. He was a diabetic. But when he died unexpectedly from a heart attack, it was very difficult for our family. It was very difficult because of the role model he was to everybody, and because he had he was such an important figure in all the decisions that were made in our family. So, I when I think about it now, because it was a lot of years ago, I try to focus on kind of what I know it sounds kind of strange, but to focus on the positive things, because we all kind of had to take on new roles and do different things and learn things that we hadn't learned before. We were all very, very focused on kind of keeping everything together. And when he left us so suddenly, I think it all made us better, not only from just a kind of life perspective, but also from a health perspective. I mean, we all started focusing more on being healthy, started focusing more on what we're eating, started focusing on more on exercising and just long-term health. So those are the things that I think about when I think back to those times. But to just answer your question in one word, it was difficult.
Well, okay. So how's your health? You look healthy.
Thank you. I'm good. I mean, I right now, I'm 6'4", 205. So, I'm staying healthy. I work out 6 days a week. Watch what I eat. But I have had an arrhythmia, which I learned about probably about 10 years ago now. Fortunately, I don't have high blood pressure. I'm not a diabetic, so I don't have those ailments. But I do struggle with a heart condition myself, and I don't take any medications or anything, but it is something, and I'm asymptomatic, but it is something that I'm concerned about, particularly when I'm going out and I'm running and doing things like that.
And just add to what Brother Charles just mentioned around his father. I lost my father about a year ago, December 2019. He died of complications from a stroke that he had in 2017. And what led to the stroke is my father struggled with alcoholism. And for years, there were times when I was angry with him because he just couldn't seem to put the bottle down. And I knew it was impacting his health. And I was so afraid of getting that call one day from my mother that he would pass away or something critical happened to him. And we got that call in November of 2017 that he had a stroke. And that started this journey for me where I wanted to understand and know why my father abused alcohol. And it did not come to me until he passed away in December of 2019. And we were going through pictures and you're trying to build the obituary. And I noticed a picture of him. He was a United States Department of Agriculture meat inspector in North Carolina. And I looked at his picture, and back in the day, you used to take pictures with all your colleagues. Every year they took a picture. And I noticed that my father was the only Black man in this picture and surrounded by other white men in the South working for the United States Department of Agriculture. Combined with that, he was responsible for building a family and supporting all of us. All of his children actually managed to go to college, even though he and my mother were not able to do so. And I believe that the impact of my father retiring from the United States Department of Agriculture and being the only Black meat inspector for a considerable amount of time is what could have probably the racism that he experienced on a daily basis. I firmly believe that contributed to his struggle with alcohol and him striving to always be considered as an equal. And research now is backing that up, that day in and day out, Black people are striving to be considered equals. And Dr. Brooks even mentioned this earlier. Sometimes our greatest assets when it impacts our health, and it comes and be the thing that's killing us. We are determined, we have a lot of strength, but at the same time, that determination and that strength causes us to overwork ourselves, and it creates unhealthy habits that we are dealing with regards to stress.
Before we leave, what words would you leave your fellow brothers who are listening to our conversation today?
I think what I would leave our brothers with is, focus on your health. Focus on being healthy, focus on what you're eating, focus on your exercise, and focus on talking to each other and just learning everything we can learn from each other. And hopefully you learn something from this discussion today.
While focusing on yourself, Also, it is incumbent upon us as a community um, to focus on those that are younger than us, and what are the things that we can do to empower the next generation so we are not seeing repeated cycles of health disparities in our communities.
I would say, in echoing what both of the brothers, Charles and Chris, stated, in medicine, we say, see one, do one, teach one. So I would say, so once you see something and it is a good thing, you mimic or you mirror that behavior. And then once you do it, then you teach someone that. So yes, look to those coming up and have a dedication. And I'll also say self-care, as Charles referenced. Self-care does not have to be selfish care, but don't assume because you are young and healthy and virile, got a nice car and a girlfriend and a decent bank account, that everything will go with your health. Okay. Your health without, and as you get older, there's a question earlier, what would you tell your younger self? That youth is wasted on the young. Don't take your health for granted.
Okay, gentlemen, we're going to leave it here and pick up the conversation next week. We hope you will all join us next Wednesday, February 3rd, 7 Central, 8 Eastern, where we'll continue our discussion on how just day-to-day living as a Black man impacts our health and well-being, and what we need to start doing as Black men to take personal accountability for our own health. Again, we want to remind everyone who's joined us tonight to go to www.releasethepressure.org to take the Heart Health Pledge, and let's work together to improve the heart health of Black communities across America.
Okay, ladies, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your two measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website